Hey everyone, so let's talk about homeopathy. It's been with us for literally centuries, right? But today, it's really up against a huge question. How does it fit into our modern, scientific world? In this explainer, we're going to dive into a really interesting perspective on this, exploring a path forward that was laid out in a piece on the Mechanism blog.
Okay, so let's start with this quote. Homeopathy stands at a crossroads. I mean, that really just nails it, doesn't it? It perfectly captures this tension we're talking about. Think about it. Down one road, you've got this rich history, this long tradition of practice and observation. But down the other, you have the super rigorous demands of modern science. So the real question becomes, can these two paths ever actually meet?
So, here's our game plan for today. First, we're going to really set the scene at this crossroads. Then we'll dive right into the main challenge. After that, we'll look at how you might blend the old with the new, check out a really cool example of this in action, and wrap up with why safety and trust are, well, absolutely essential.
All right, first things first, let's get some context. You know, it's important to remember that homeopathy isn't some new fad. We're talking about a system that was built over generations. Generations of practitioners who were carefully, meticulously observing and writing down everything they saw. And all of that created this huge body of knowledge that, for a lot of people, has provided real relief.
Okay, before we get any deeper, we've got to talk about the foundational principle here. Like cures like. This is the absolute core idea of the whole system. Basically, the belief is that a substance that would cause certain symptoms in a healthy person can, when it's in a super diluted form, actually kickstart the body's own healing response to those very same symptoms. It's a fascinating concept.
Okay, now we're getting to the heart of it, the real tension. We're about to see how the very thing that makes homeopathy so unique, its greatest strength, really, is also its biggest challenge in today's world.
And this really lays out that conflict perfectly. Look, on one hand, its strength is this deeply personal approach. It's all about treating you, the unique individual, not just a label or a disease. But, and this is the big but, on the other hand, that same personalization, that subjectivity, when you have thousands of remedies at all these different potencies, well, it makes it incredibly difficult to study using the standardized methods of modern science. How do you run a classic clinical trial on that? So, where do we go from here? What's the solution? Well, the path forward that our source material suggests isn't about just throwing out centuries of tradition. Not at all. It's about evolution. The idea is to take this historical practice and enhance it, bring in the tools and the rigor of modern science, not to replace it, but to get a much deeper understanding of what's going on.
And this evolution has a pretty clear three-pronged strategy. It's really practical. Step 1, you run well-designed trials to figure out what's actually effective. Step 2, you use all the cool modern tech we have to try and uncover the biological mechanisms, how it might be working. And finally, step 3, you focus your research on specific applications where certain remedies already seem to show a lot of promise.
And this is where it gets really interesting, because it takes these big ideas and makes them super concrete. I mean, think about it. We could have systematic studies looking at specific, well-known remedies like belladonna for inflammation, or, and this is wild, using things like nanotechnology or molecular biology to explore how these highly diluted substances could possibly have an effect. It even suggests zeroing in on organ-specific remedies, like Cardus marianus for the liver or Crataegus for the heart.
Okay, so this all sounds great in theory, right? A nice, neat plan. But has anyone actually put it into practice? Has anyone tried to build this bridge? Well, yes. Let's look at a case study that did exactly that.
So a research team decided to tackle chronic lower back pain. And if you know anything about it, you know it's a notoriously tough thing to treat. So they set up a proper, randomized controlled trial. But here's the brilliant part, the real key. They didn't do it to homeopaths. They did it with homeopaths. They partnered up to deliver that personalized, individualized pair, but they did it inside the structure of a modern research study.
And the results were pretty striking. Looking at what the patients themselves reported, there were significant improvements, not just in managing their pain, but in their overall quality of life too. So this study really acts as a proof of concept. It shows that, yeah, it actually is possible to build that bridge between the traditional personal approach and rigorous scientific methods. But look, proving something works in a study is only part of the story. For any kind of healthcare to have a credible future, it really boils down to two absolutely crucial things: safety and trust.
And that foundation of trust, it's built on three main pillars. First, you've got to have super strict purity standards. We're talking remedies that are totally free from contaminants like heavy metals or pesticides. Second, you need rigorous quality control in the manufacturing process. And third, you absolutely need a solid regulatory framework to watch over the whole thing. These aren't just boring details. They are non-negotiable for patient safety and for building any kind of credibility.
And that really brings us full circle, back to the core message from our source. The whole point here isn't to pit tradition against science in some kind of battle to prove or disprove one another. It's about something bigger. It's about a commitment to just being curious, to working together with the ultimate goal of simply deepening our understanding of what healing is all about.
So as we wrap up, you realize this whole conversation about homeopathy points to a much bigger question, one that applies to all of healthcare, really. How do we best blend the wisdom of tradition with the incredible power of scientific transformation? It's a huge question, and the answer is definitely going to shape the future of medicine for all of us. Thanks so much for tuning in to this explainer.